In this video, I'll be giving you a bit more information about the specific anxiety management techniques that we have recommended for people with learning disabilities. I'll explain why these techniques might be helpful and things that you can consider when you support the person you care for to try them out. The first set of videos that I'm going to refer to focus on breathing techniques. We naturally breathe in and breathe out at a steady pace and depth that enables us to maintain a good balance of oxygen and carbon dioxide. When we feel anxious, we perceive a threat, which might be a real threat or might be our brain making us think that something is a threat when it isn't. Whether the threat is real or not, this triggers the fight or flight response in our bodies as we decide what to do. The fight or flight response is also known as the adrenaline response. As part of this response, our breathing rate increases, much like after exercise, so the levels of oxygen and carbon dioxide in our bodies become imbalanced. If it stays this way, we might notice other physical symptoms like dizziness or a headache, which all keep the feeling of anxiety going. It is therefore important to try out breathing techniques when we feel anxious, because by consciously changing the speed and depth of our breathing, we can help ourselves get out of the fight or flight mode and back to a relaxed state. There are different breathing technique videos to choose from, such as the breathing exercise for your imagination, balloon breathing, and the 5-second breathing exercise. This is because different people will prefer different breathing exercises. Some of them are more visual, for example, imagining a candle being blown out or a balloon inflating and deflating, whereas others use more verbal instructions. You can encourage the person that you care for to try a few out to find the ones that suit them best. If the person that you care for is trying the breathing exercise when they are in a state of heightened anxiety, then you can support them to practice the breathing exercises a few times until you notice their breathing rate return to normal. For all of the breathing exercises, it is a good idea to support the person you care for to find a comfortable position before they start and to practice in a room that might be quieter where there are less distractions. In a similar way to breathing, the next exercises, which are in the videos called How to Relax the Muscles in Your Body 1 and 2, are related to the fight or flight response. Whether we actually are or not, our bodies think we're in a dangerous situation and our muscles become tense so that we're ready to physically respond to the perceived threat. Sometimes when we're anxious, we won't realise that our muscles are tense, but our shoulders might be higher, our jaws might feel tight, or our teeth might be clenched. We also might notice muscle tension in the form of backaches or tension headaches. The exercises in these videos are based on the principle of progressive muscle relaxation, which is a systematic way of moving through the muscle groups in our bodies and tensing, then relaxing them to help our bodies return to a relaxed state. The exercises include the whole body, but it's important that the person you care for is trying them out within their physical capabilities and not tensing any part of the body which might feel painful for them, so you could help them choose which parts of the exercises to try. You could also help them schedule these exercises, as they're more uncomfortable to try out after a heavy meal. As with all of the techniques, help the person that you care for to find a comfortable position so that they're able to move their bodies without having to strain too hard. It might be helpful for the person you care for to wear loose clothing and take off their shoes for this one. The next technique that I'm going to talk about is in the video called Explaining Mindfulness and the 5 Things exercise. An easy way to think about mindfulness is to see it as the opposite of automatic pilot mode. Automatic pilot mode is when we're not focused on what is going on right now. This is often the case in anxiety, because rather than thinking about what we are experiencing in the here and now, our attention is instead on the future. For example, running through lots of different what-if scenarios in our mind that we fear might happen. Sometimes we can also feel anxious if our attention is focused on the past. For example, going over and over a past situation in our head and noticing what we felt went badly about it. Getting caught up in thinking too much about both the past and the future can keep us stuck in a cycle of feeling anxious. The 5 Things exercise focuses on different senses. So to support the person that you care for tried this one, you could ensure that the environment they're carrying it out in has enough different objects and stimuli in it. For example, if you know that the person you care for prefers certain textures, you could put these objects in the room and in close enough proximity to the person so that they are soothed by these textures when directed to try and find 3 things they can touch. Let the person that you care for take as long as they like to complete this exercise. The important thing is not how quickly they can notice these things, but that their attention is on their senses and experiences in the present moment, helping them to feel less anxious. The final technique that we have recommended to help the person you care for feel less anxious is in the video called My Relaxing Place. Often when we feel anxious, we feel unsafe and fearful, so this exercise focuses on using our imagination to create an image of a safe place, regardless of whether that place is real or not. Creating a safe place in our minds can help us be able to find a sense of calm and security when the situation around us might feel uncertain and scary. As this technique uses imagination, it can be harder for some people than others, but you can help the person that you care for bring their safe place image to life, making it more memorable and relaxing. For example, they might have picked a place that's real that they visited, so you could look at photographs with them to help them remember the details. This is a really nice opportunity to talk through some happy memories or stories that they might have from visiting this place. Other people might prefer to create a fantasy safe place, so you could help them look for visual prompts of colours that they want to imagine, or help them search for examples of sounds that they want to imagine hearing on the internet. Some people might choose to draw a picture of their safe place, so that they have a visual reminder when they want to think about it. You can also encourage the person that you care for to give their safe place a name or a memorable phrase that you can both use when you notice things becoming stressful and want to remember this strategy. For this technique, practicing it in a quiet environment can be really helpful so that people are able to fully explore their imagination. The person that you care for might want to find a quiet place and make a sign for the door so that they're not disturbed when they're practicing this technique if they don't want to be. To make this one a little easier, it's good to get rid of the tension in our bodies before we start. So you can encourage the person that you care for to try out a breathing or a muscle relaxation exercise before they give this one a go. I hope that you can use the tips in these videos to help the person that you care for practice the anxiety management techniques and find the ones that they find most helpful.